Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here is what I bring to you all from the world of medicine. Robotic-assisted lobectomy for early-stage lung cancer and its comparison with video-assisted lobectomy regarding the patient-reported quality of life. Dr. Patel and colleagues reported that the study sought to determine the difference in patient-reported health-related quality of life or HRQOL between robot-assisted surgery and video-assisted surgery at 12 weeks after surgery and incremental cost per quality-adjusted life year or QALY at 12 months after surgery. Dr. Patel from 4 academic sites in the United States, Canada and France enrolled 406 patients with early-stage lung cancer who were candidates for minimally invasive lobectomy. Patients were randomized to receive either RTS lobectomy, that is intervention, or VATS lobectomy, that is control. Patients were blinded to the type of surgery until the 12-month follow-up. Each patient completed questionnaires at baseline, post-operative day 1, weeks 3, 7, 12 and months 6 and 12. Of 406 patients screened, 45.81% were randomized. At final eligibility review, 82 were analyzed in the RTS arm and 83 in the VATS arm. All patients were followed for at least 12 months. Mean age was 67.36 and 66.67% were women. There were no significant differences in the body mass index, comorbidities, pulmonary function, smoking status, location of tumor, tumor size, or disease stage between arms. Based on the findings, the authors said, early results of the RAVEL trial suggested that the RTS lobectomy is a cost-effective intervention which is associated with better patient-reported HRQOL when compared to VATS lobectomy within 12 months of surgery, and RTS lobectomy is also associated with superior lymph node sampling. Air pollution, which may be included as risk factor for patients with lung cancer who have never smoked. To assess the connection between pollution and lung cancer diagnosis, Renel Myers and team compared the cumulative 3-year versus 20-year exposure in females with newly diagnosed lung cancer who have never smoked. The researchers collected detailed information on the patient's age, sex, race, country of birth, age of arrival in Canada for foreign-born Canadians, their occupation, family history of lung cancer, and secondhand smoke exposure. A detailed residential history from birth to cancer diagnosis for residences within Canada and prior residences outside of Canada, foreign-born immigrants were recorded. Cumulative exposure to PM2.5 was quantified with a high spatial resolution global exposure model. The magnitude of 3 years versus 20 years exposure were compared. Myers acknowledged that even a 20-year cumulative exposure does not capture childhood exposure and is an underestimate of lifetime exposure and depends on countries of residence. Of the 236 female patients with lung cancer who had never smoked, 83.3% were foreign-born, 71% were Asians. The mean years lived in a foreign country was 37.3 years. The mean age of lung cancer diagnosis was 66 years. 92.8% of them had adenocarcinoma and 55.9% were stage 3 or 4 lung cancer. For foreign-born Canadian females, only 2% had 3-year cumulative PM2.5 exposure of greater than 10 microgram per cubic meter, whereas 20% had a 20-year cumulative PM2.5 of greater than 10 microgram per cubic meter. All had a PM2.5 exposure greater than 5 microgram per cubic meter. Our study demonstrates the importance of incorporating long-term cumulative exposure to ambient air pollutants in the assessment of individual lung cancer risk in combination with traditional risk factors, said Dr. Myers. High sexual dysfunction among women with lung cancer. Sexual dysfunction is highly prevalent in women with lung cancer, with most survey participants reporting little to no interest in sexual activity, according to research led by Narges Flores. Reporting results of the Sexual Health Assessment in Women with Lung Cancer or SHAWL study, researchers show marked differences in sexual desire or interest and vaginal pain or discomfort when comparing before and after lung cancer diagnosis. The SHAWL study is an observational cross-sectional international survey administered via the GO2 Foundation for Lung Cancer and the Lung Cancer Registry. The study utilized the Patient-Reported Outcome Measurement Information System or PROMIS sexual function and satisfaction measures, which is a validated questionnaire to evaluate sexual health. Study participants, mostly females, were recruited between June 2020 to June 2021. Participants were asked about sexual activity pre-lung cancer diagnosis, and over the past 30 30 days prior to completing the survey. Of the 249 women completing the survey, 64% patients had stage 4 lung cancer and 45% were receiving targeted therapy, with 87% taking the medication for more than 6 months. At the time of survey completion, 33% were taking antidepressants and 14% were taking beta blockers. Within the prior 30 days, 53% participants had sexual activity with themselves or someone else. 77% participants reported little to no interest in sexual activity. 67% stated rarely or never wanting to have sexual activity. The most common reasons negatively affecting participants' satisfaction with their sex life included fatigue, 40%, feeling sad or unhappy, 28%, issues with their partners, 22%, and shortness of breath, 15%. When comparing before and after lung cancer diagnosis, marked differences were noted in decreased sexual desire or interest, which is 15% versus 31%, and vaginal pain or discomfort, which is 13% versus 43%. Of the 127 participants that had sexual activity in the last 30 days, 59% reported significant issues with vaginal dryness and 26% vaginal pain or discomfort during sexual activity. Lung cancer risk prediction Nomogram for female non-smokers. About 53% of lung cancers in females are not attributable to smoking worldwide, and a new model presented at the IASLC World Conference on Lung Cancer may allow clinicians the ability to assess and stratify lung cancer risk in female non-smokers in China. Lan Guo and team examined data from 151,834 patients in China from October 2013 to October 2019 from the cancer screening program in urban China. The aim was to develop and validate a simple and non-invasive model which could assess and stratify lung cancer risk in female non-smokers in China. Patients were randomly divided into the training, which is 75,917, and validation, which is again the same amount sets. Elder age, history of chronic respiratory disease, first-degree family history of lung cancer, menopause, and history of benign breast disease were the independent risk factors for lung cancer. Using these 5 variables, Dr. Go and colleagues plotted 1, 3, 3-year and 5-year lung cancer risk prediction nomograms. Related risk factors were identified through multivariable Cox regression analysis, followed by establishment of risk prediction nomogram. Discrimination, that is area under the curve or AUC, and calibration were further performed to assess the validation of risk prediction nomogram in the training set and then validated by the validation set. We developed and validated a simple and non-invasive lung cancer risk model in female non-smokers that can be applied to identify and triage patients at high risk for developing lung cancer in female non-smokers, Dr. Go reported. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.